Gastric bypass surgery is a weight loss procedure that has been used for over 60 years worldwide, making it the oldest weight loss surgery still performed today. Gastric bypass surgery is a procedure that has essentially a dual action for weight loss. First, it restricts the amount of food a person can eat at a time because of the small gastric pouch. And second, it changes the digestive process, essentially creating a shortcut in the intestines, which result in a decreased absorption of calories. These changes make gastric bypass a very effective weight loss procedure. This procedure allows patients to lose up to 90% of their excessive weight. Aside from restriction in caloric intake, gastric bypass is believed to be causing hormonal changes in the body, which can help in control of diabetes. As a result of these changes, gastric bypass is a very effective tool in helping overweight patients who also battle diabetes. Interestingly, the positive effect on diabetes after gastric bypass is almost immediate, and patients notice improvements in their blood glucose levels long before any significant weight loss. Gastric bypass surgery has gone through numerous changes over the past 6 decades, which made the surgery safer, less painful, and more effective. Nowadays, a typical gastric bypass takes about 1.5 hours to perform and will in most cases require an overnight stay in a hospital. Gastric bypass is performed laparoscopically through only 5 tiny incisions. Due to advanced pain control technique we use, the pain after surgery is minimized and patients are comfortable taking short walks 2 hours after the procedure. There are several aspects of gastric bypass each patient who chooses to undergo this procedure should know. First, gastric bypass is a powerful weight loss tool. It drastically reduces one's appetite and overall caloric intake. Therefore, patients after gastric bypass should remind themselves to eat at regular intervals and should consume meals with a balanced nutritional content. This strategy helps prevent excessive weight loss and malnutrition. Second, every patient after gastric bypass should take vitamins and have their vitamin levels checked by blood work regularly. Vitamin deficiencies can lead to serious neurological problems as well as anemia. Fortunately, taking daily vitamins is not complicated and will help prevent many health issues. Third, anything with sugar should be avoided after the surgery, as it may make patients who underwent gastric bypass feel ill. After gastric bypass, because of the changes in the stomach and intestines, the sugar does not break down when it's ingested, and therefore it can cause nausea, diarrhea, and other side effects such as feeling hot flashes, chills, and being tired. These side effects of gastric bypass is called dumping syndrome. Careful adherence to a recommended diet is essential in avoiding this complication. There are also common misconceptions about gastric bypass. One of them, for example, is that gastric bypass is permanent. This is not true, as gastric bypass can be reversed if necessary. The reversal operation can be complicated, but it is entirely possible. Reversal of the bypass can be done for medical reasons, such as malnutrition, for example. The second misconception about gastric bypass is that if patients gain weight after surgery, there is nothing that can be done to help the situation. This is farthest from the truth, as we now have several great options available to reverse weight gain after gastric bypass surgery. Gastric bypass can be modified and tweaked by a small procedure to improve its effectiveness. One of the other important aspects of gastric bypass is absorption of medications after the procedure. Although there is a concern that certain medications may not be absorbed the same way as before the surgery, I rarely see this in my practice. Most of the time, patients after gastric bypass are able to take their medications without any problem. Of course, as their various health conditions improve, the doses of the medications may need to be adjusted accordingly. Choosing gastric bypass surgery is an important decision, and patients are encouraged to seek as much information as possible before undergoing the surgery. Gastric bypass is a wonderful life-saving procedure which can help patients to gain control in their food intake and lose weight permanently and effectively. However, this operation will require patients to undergo a lifestyle change and to follow instructions. If you have any additional questions about gastric bypass surgery, please don't hesitate to contact our office. Thank you.